Hello and welcome to our live town hall meeting with Spokane residents. Thanks for joining us. We're about to dial out to thousands of residents in the city of Spokane. We appreciate your patience. We'll be getting started in just a moment. As we dial out, I'll be instructing our phone audience how they can participate in tonight's live town hall meeting. Again, thanks for everybody for joining us for the Spokane County Teletown Hall. We appreciate you being on the line. We'll be turning it over to Council President Breanne Beggs in just a moment here to get us started, but in the meantime, I'll let you know how you can participate. For those of you who dialed in early on our inbound participant line, thank you for joining the live town hall early, being on time. For the rest of you, we're dialing out to our live Teletown audience right now, about 75,000 households. So thanks everybody for joining us. We'll be done with our dial out in just a moment here, and when we're done, I'll turn it over to Spokane City Council President Breanne Beggs, and then we'll get started. Now, if you're joining and you have a question you'd like to submit for Q&A tonight, we will have some brief introductory comments, but we'll spend most of our time on Q&A with you and asking you to answer some survey questions on your phone. So you can submit a question by pressing 0 at any time during this live forum. Again, if you're on the phone, press 0 to submit a question at any time during this live forum. Stick around to vote in our polls using your phone, and we'll go ahead and get started now. Remember, 0 to submit a question. My pleasure to kick off this live town hall by turning it over to Spokane City Council President Breanne Beggs. Go ahead, Breanne.
Hi, I am Breanne Beggs, and I would like to welcome you to this regional town hall addressing how we're responding to COVID-19. We started out the year in 2020 thinking about census, and we were saying everybody counts. But I think now it goes a little deeper, and I'm reminded of the credo of Detective Harry Bosch from the Lincoln Lawyer series. And he says, everybody counts or nobody counts. And that's why I'm so glad to be joined on stage with our regional partners and in the audience with several other elected officials from around. We are working together to move through this, and it's only together that we will be stronger and prevail. Thanks so much. Ask your questions, and remember, we are stronger together. Thanks.
Well, good evening. Dr. Bob Lutz, County Health Officer, and Breanne was talking about counts, and I think that's certainly what people have come to expect from me. We've been watching the data, and I think the data over the last couple of weeks have been concerning. I'm cautiously optimistic over the past few days, but again, a few days does not a trend make. And I think I am, however, somewhat encouraged by some recent data that I saw that social distancing in the Seattle area has indeed made a difference. We know that Governor Inslee's Stay Home, Stay Healthy proclamation is making a difference throughout the state, and I believe it's making a difference here. So I'm encouraged, but again, that does not mean we need to stop the work that we're doing. We need to continue to do the social distancing and follow through with all of those recommendations.
Good evening, everyone. I'm Spokane Mayor Nadine Woodward. I want to thank Dr. Lutz for leading the effort on this health emergency with your daily updates, Doctor, and also guidance with our region's COVID response. I'd like to point out that the group behind me, those of us here on this stage, taking part in tonight's town hall, are representative of what our regional response to COVID and the organization has been about. The health department, Spokane County, the cities within the county, our state lawmakers have been meeting every single day for nearly 4 weeks as we battle an illness that has already taken more than a dozen of our community members. The region has come together in a collaborative way that I have never witnessed in the 30 years that I have lived here. Standing up an alternative assessment site, more shelter space for our vulnerable population, also standing up an isolation and a quarantine center for them as well, mobilizing meals for needy families, our seniors, children, equipping our first responders with protective gear, and now working very hard on an economic recovery plan. And our effort goes beyond our own county. I'm in regular contact with Governor Inslee, with our congressional delegation, also with the mayors of the state's 5 largest cities, which happen to be all women, as we share our stories and we learn from one another. It's an incredible experience, and all of the ones that I'm in contact with on a regular basis are very impressed with our ability to mobilize in a very proactive way throughout our region, and also to keep our healthcare system from being overwhelmed. So thank you for joining us tonight, and I look forward to taking your questions.
Hello, I'm Mayor Ben Wick from the City of Spokane Valley, and we at the Spokane Valley are also been a part of the daily Emergency Communications Center briefings and discussions as we try to figure out how to move our community forward. And I also want to say thank you to all of you out there. It takes everybody to work together to get through this, and you've done your part as well. We've been embracing our social distancing. Manufacturing businesses have been able to convert their operations over to help us with personal protective equipment. Volunteers with Meals on Wheels are still delivering meals to seniors. And our community is pulling together like we've never seen before. And so I wanted to take a time to not only say that the City of Spokane Valley is happy to be the part of this partnership, but also thank you for all that you're doing out there in the community.
Good evening. I'm County Commissioner Al French, current chair of the Board of County Commissioners, also representing Commissioner Cooney and Commissioner Kearns. This community has come together in an incredible way. Our regional partners, both from a municipal standpoint, from the state and federal standpoint, have done some incredible things, and the health officer and the business community have united to be able to address not only the medical issues confronted by this virus, but also the business impacts. So while we're trying to mitigate the impacts for our business community, the next step is creating that plan for how do we get out of this? How do we recover and get our economy standing back on its feet and getting the most number of people back to work as soon as possible? So I'll tell you that our elected officials are coming together to create that strategic plan in alignment with our business communities, GSI, and the other chambers to be able to create that plan and chart a path forward for us to get out of this and back to the healthy economy that we had before this started. Thank you. Look forward to your questions.
Hi, I'm State Senator Andy Billig, and I'm pleased to be here today with the city and county leaders. And our appearance together highlights the incredible cooperation that we've had at the local and state levels of government and with our federal partners as we work to respond to this crisis. That cooperation also extends to our community, where our collective efforts at social distancing have had a meaningful impact to slow this virus. We know that if we continue to all do our part, we will minimize the health dangers and move more quickly into our economic recovery, and we will do that together. Before the legislature adjourned a couple weeks ago, we were able to take significant action to address the COVID-19 outbreak. With bipartisan support, we allocated $200 million for public health, for healthcare response, and for testing. We also made emergency shelter funds available to cities and counties, among other actions. One of my other important roles as a state legislator is to make sure that your voice and the collective voice of Spokane is heard at the state level. And I know the rest of the Spokane legislators have also joined in this effort to convey our community's needs in helping coordinate state and local response efforts. I never forget that we work for you. And to do our job of representing you well, we need to hear from you. And that's why I'm so excited for our conversation this evening, and I hope you'll stay in touch with questions and comments that you may have at any time. Thank you.
Thank you, Senator, and thank you to the rest of our speakers who joined us. Very much appreciate you being on today. And thank you to all of our callers from Spokane County who have joined us for this live forum. I'll go ahead and go over how you can participate again real quick. Just press 0 if you want to submit a question. Many of you are already doing that. We have some of you in line already. If you'd like to get email updates, we can have you sign up for the Inland COVID Response e-newsletter by pressing 7 right now. So again, if you'd like to get the Inland COVID Response e-newsletter, we'll keep you better updated directly via email by pressing 7 on your phone. Speak to one of our operators and give them your email address so that we can keep you updated electronically in the future. So we'll go ahead and start taking our questions right away. We're going to get our first one up live from Danny. Danny, looks like you're in Spokane. Go ahead.
Hi, how are you? Thanks for taking my call. My question is regarding the caregiver agencies here in the Spokane area. What protocol do they have in place for protecting the clients, the elderly population? They go into their private homes. And I would like to know, does the Spokane Regional health department or whoever put any type of protocol in place for the caregivers to follow to ensure the safety of the vulnerable elderly population here in Spokane?
Yes, ma'am. With respect to those protocols, we are following guidelines from both the Centers for Disease Control as well as Department of Health. And so as we have received those guidelines, we have pushed them out to the various care agencies. We also have individuals who have gone on site to provide guidelines and recommendations. And then we also ensure that, for example, all healthcare workers, when they come to work in the morning, they are taking their temperatures, they're reporting on symptoms, and then we're following up with those very closely. So those guidelines and protocols are in place to, again, as you mentioned, really ensure that some of our most vulnerable people are taken care of.
All right, thank you for the answer, and thank you for the question from Danny. Much appreciated. We'll get on to our next question in just a moment here, but we've also got some survey questions that we'd like our participants to answer during this forum, and that'd be some very valuable feedback for us. So you can go ahead and vote on this using your phone. And I'll go ahead and read the first survey question now. On a scale of 1 to 5, how concerned are you about contracting COVID-19? Press 1 if you're not concerned at all. Press 2 if you're minimally concerned. Press 3 if you're somewhat concerned, and press 4 if you're moderately concerned. Press 5 if you're very concerned. Again, our question for you, on a scale of 1 to 5, how concerned are you about contracting COVID-19? Press 1 for not concerned at all. Press 2 for minimally concerned. Press 3 for somewhat concerned. Press 4 for moderately concerned. And press 5 for very concerned. So go ahead and vote on that now. We've got several more polling questions for you, so we encourage you to stick around and vote on those. That feedback is very valuable for us. So thank you very much for those of you who are voting in the poll. We'll run another one in a minute here. Let's get our next live question up from Terry in Spokane. Hey, Terry, you're live. Go ahead.
Oh, yeah. I'm actually a Spokane Cheney resident. How important is it to keep unnecessary injuries out of our exhausted hospital systems right now? As a memorandum came across Inslee's desk asking for a lax on residential development for single-family homes, when in fact the majority of the homes out here are not for single families. They are 300,000 plus. The Growth Management Act also requires public process. What is Spokane doing asking for residential construction to continue during these times?
Terry, thank you for that question. The governor has put a moratorium on, or a ban on, residential construction. However, I am part of a letter that numerous cities in our county are signing and sending to the governor's office because we have a housing crisis in our region. And personally, I've been getting calls from some of our community members who have found themselves falling in a gap where they are having a home that is being built. It's not finished, but they have now sold the home that they're currently living in and have no place to go. And so from what I understand in the residential construction business, that there are ways that you can social distance and still build homes. And we need homes more than you know. Thanks for the question.
Thank you so much, Terry, for that question. Thanks for the answer. Let's get to our next one in just a moment. I will ask that our speakers, if you would go ahead and introduce yourself first so the folks on the phone know who's answering each question. That'll be very helpful. Thank you so much. We're going to get to our next polling question in just a moment here. First, we're going to get our next phone question up from Teresa in Green Acres. Go ahead, Teresa, you're live.
Oh, hi. My name is Teresa. I live in Green Acres, and I was curious why there seems to be no mandatory masking order from the county or from the state of Washington. In South Korea, the Czech Republic, and now Riverside County here in the U.S., they have issued mandatory masking orders. And in South Korea and the Czech Republic, they have hugely lower fatalities than we have in the United States from COVID-19. I just wonder why we're not doing that here. Thanks.
Yes, ma'am. This is Bob Lutz with respect to the question around masking and voluntary versus involuntary masking. I think, again, the science continues to evolve. Certainly, the most recent data suggests that those individuals may actually be able to transmit the infection and be asymptomatic, and that's why you see all of us currently wearing masks. Again, I think, as I mentioned earlier, we know that social distancing works. Social distancing in conjunction with voluntary use of masks does demonstrate that we're caring about others. The reality is, however, these masks are not necessarily protecting me from somebody else who's getting sick. And so again, I think these masks that we're wearing now, that we encourage people to wear out in the community, are really demonstrating the fact that we care about each other, and again, taking all those social distancing guidelines in hand.
Thank you, Doctor. Thank you for the question, Teresa. We'll get our next one up in just a second here. First, we've got another survey question for you. We want to know, what trusted source do you rely on for information on the response to the spread of COVID-19? Press 1 if it's the COVID response websites. Press 2 if it's social media. Press 3 if it's television news. Press 4 if it's the newspaper. And press 5 if it's the radio. Again, what trusted news source do you rely on for information on the response to the spread of COVID-19? Press 1 for the COVID response website. Press 2 for social media. 3 for television news. 4 for the newspaper. And 5 for radio. Let's get our next question up right away. We've got one here from Steve. Steve in Spokane, you're live. Go ahead, sir.
Oh, I didn't know I was live. My question is, I have been renting up here in Spokane. I've lived here all my life. I'm 76 years old. I have type 2 diabetes. I have a Social Security of $1,155 a month. And I part-time Uber driver before this happened. So now I have no income other than that. And where I'm at, the apartment I live in, they're raising my rent $40 starting the 1st of May, $40 a month. And I've heard all this stuff about people that own houses, their mortgages are getting, they can skip 1 or 2. I haven't heard anything about renters. And, I'm in a tough spot. And they're going to raise my rent $40 a month. I just think that's really bad. And that's
Thank you, Steve. Who'd like to take that one from Steve?
Spokane Mayor Nadine Woodward. Thank you, Steve, for your question, and I completely can understand the hardship. We're hearing from many constituents who are experiencing the same thing, whether they've lost a job, and now it's Wednesday. Friday could be the 3rd paycheck that a lot of people have lost. We have passed a moratorium in the city of Spokane on evictions and on foreclosures. We have suspended any shutoffs of utilities, water, for instance. If you need help with your utility bill, there is assistance, Steve. So I just want to let you know that there are resources out there. Sometimes finding them isn't always easy. But if you live in the city of Spokane and you need help with your utility bill, we just did a fundraising drive with Avista, the city of Spokane, in our community, very generous. In the last week, we've raised $100,000 to help people pay their utility bills. If you need help, Steve, call 456-SNAP. We are also working on the possibility of being able to offer rental assistance to people like you who are having a hard time paying for your rent. Tomorrow, we are going to listen for this, start a helpline, a business and financial helpline for people who want to get connected to services and resources out there who are going to help you during this COVID emergency.
Thank you, Mayor Woodward. And thank you for your question, Steve. Appreciate you being on today. Thanks for submitting that question. We're going to get our next question up right away. We've got this one coming from Robin in Otis Orchards. Hey, Robin, you're live. Go ahead.
Hi, mine's fairly simple. One of the first essential requirements to see if we're sick or any of our family members are is to take our temperature. However, for the last 2 weeks, I have tried to find a thermometer in Spokane and northern Idaho, and there are no thermometers anywhere. Do you have any suggestions on where we could buy them? We can't find them online, or another way to determine if you have a temperature.
Yes, ma'am. This is Dr. Bob Lutz. You speak, again, I think, to one of the issues that we're all experiencing, that of supply shortages. We talk a lot about what we call personal protective equipment, but this also extends to such simple objects as thermometers. You're not the only person. We're having that to be a universal problem. A lot of times I just tell people, do you feel warm? Do you feel a chill? That may be in and of itself sufficient to kind of suggest a fever. So again, it's how you feel, and then are you having any other symptoms? Those would be the things that I would recommend in lieu of not being able to use a thermometer.
Thank you, Dr. Lutz, and thank you, Robin. Great question. Thank you for asking it. We'll get our next one from Rosamond in Spokane Valley, and she's asked me to read her question, which is, will asymptomatic people be tested, or will they just hang out and ride it out and see where it goes? Thanks for the question, Rosamond. Dr. Lutz, can you take that one as well?
I shall, thank you. Yeah, the question around asymptomatic individuals, right now, the limiting factors have been the fact that we haven't had enough testing materials to actually do testing uniformly. I do believe that the testing availability is increasing, but we still are limited in being able to test as many people as we like. So the guidelines and recommendations are right now that we are not testing totally asymptomatic individuals. I will tell you, however, that there are some new tests out there that are looking encouraging to see if people have actually been infected and may have been asymptomatic. So there's a lot of buzz right now about what are called antibody tests, and those may be useful at some point in this work to show that somebody was infected and may have been asymptomatic and may actually have mounted an immune response to the infection. So stay tuned for that. But for right now, as I said, there's really no recommendations, and it's very difficult to test asymptomatic people.
Thank you, Doctor. Hang tight. We've got another one for you. This one came in from Facebook, and the question is, how are you making sure people are going to stores to buy essentials and not browsing because they are bored? I'm sorry, that seems like a better one for Commissioner French. Commissioner French, you mind taking that one? The question again
Agreed,
is,
thank you.
how are you making sure? Go ahead.
Actually, at this point, we rely on trust, that folks out there are being honest if they are stopped, that they are taking care of essential business and not just out casually engaged in activities and stuff. So we're hoping that we don't have to get to a point to where it requires some kind of documentation, where I don't think we're going to get there. But we do rely on folks to take care of yourself, take care of your neighbor, and stay home. If you don't have to be out, stay home.
Thank you for the answer. Appreciate it. Let's get another question in here in just a moment. First, we've got another survey question for you to vote on using your phone. We want to know what concerns you most about the COVID-19 impact. Again, vote on your phone. Press 1 if it's being out of work. Press 2 if it's contracting the virus. Press 3 if it's others not following the stay-at-home and stay healthy order. Press 4 if it's extending the stay home, stay healthy order again, and press 5 if it's stigmatization and discrimination. So again, our question for you is, what concerns you most about the COVID-19 impact? Press 1 if it's being out of work. Press 2 if it's contracting the virus. Press 3 if it's others not following the stay home, stay healthy order. Press 4 if it's extending the stay home, stay healthy order again, and press 5 if it's stigmatization and discrimination. Thank you so much for voting in that poll. We've got several more, so stick around for those. Let's get our next live question up from Sally. Sally in Spokane Valley, you're up.
Yep. I'll tell you what I'm concerned about is everybody should be staying out of the streets as much as they can. I'm ancient, and I don't want to die from this stuff. And the thing is, not enough people are taking it seriously. And I wish we do like they do in L.A. You wear your mask or you stay home or you get a fine. I don't know why nobody's got the guts to do that in Spokane Valley, Spokane County.
Thanks, Sally. Can we toss that one to Mayor Wick?
Sure. I think we're all trying to do our part. We're definitely encouraging. I think the governor's proclamation of stay home, stay healthy has been out there. We're asking people to be respectful, wear the mask to prevent the spread of the disease to others, and just really encouraging everybody to step up. I know a lot of people have been stepping up. I see masks going out there with people out in the community, and we're just continuing to ask people to do that.
Thanks so much. Appreciate that answer, Mayor Wick. Thank you, Sally. Appreciate your question. And real quick here, as a reminder, if you would like to get email updates, again, press 7 on your phone. We'd like to keep you as updated as possible moving forward. So if you'd like to get email updates as we move through this crisis, we'd love to keep you updated via email. Again, you can press 7 on your phone to get email updates, and we'll get your email address, add you to that email update list, and we'll be able to keep you updated quickly and effectively with accurate information in the future. Got our next question coming live from Melody. Melody in Airway Heights, you're up. Go ahead.
Hi, thank you for taking my call, my question. I kind of have two in one. One is the factor of all the hoarding and stuff. Is there being something done from them hoarding and price gouging people for the items? And two, is there a way to make sure that they can't be returning the items back to the stores after all this is done?
Thank you, Melody, for that question. This is State Senator Andy Billig. And I think on the question of hoarding at stores, I think Commissioner French, really hit it right on the head with this is about us being responsible as individuals and being community members. It's about us taking what we need and leaving behind. We do not have enforcement on hoarding right now. That's just not where we are putting our resources as a state. Price gouging, however, there is active work being done, and the Attorney General, Bob Ferguson, has been very proactive on going after people who are price gouging. And on the Attorney General's website, you can go and find resources and ways to submit any price gouging that you suspect, and they will follow up on that claim. Thank you.
Thank you for the answer. Thanks for that question, Melody. We'll get another survey question up in just a moment here. First, we've got another Facebook question. Question is, with less people on the road, we are seeing more people speeding. What is being done about that? Sheriff, would you like to take that one on?
The reality is we are stopping people for speeding. So if they're speeding, we find that happening, we do stop and we do issue tickets. The one thing that we are trying to do, though, is to make sure that we're maintaining social distance and doing the best we can to protect both the deputy and the person that we're in contact with. So speeders, if you're out there, we are making those stops. I'd like to address the question, I think 2 questions ago. I just looked it up. LA is not stopping and giving anybody tickets for being out and about. That's a myth.
All right, thanks for that answer. Let's get our next question up right away. 1 second. We've got Gretchen up live next. Gretchen, looks like you got a 2-part question. Go ahead.
Yes. My first part of the question is there a number locally that we can call or a place we can email to get immediate answers to our questions rather than just going online and looking at the frequently asked questions, because it doesn't answer this question I'm going to ask now. If we get COVID-19, has there been any research on what makes a difference between those that survive and those that don't? I'm not talking about pre-existing condition, because I know that's one of the differences. But are there certain behaviors we can do that will increase our chances of surviving? And I know one of the issues with COVID-19 is inflammatory or inflamed organs or whatever, do anti-inflammatories help?
Thanks for the question. This is Dr. Bob Lutz. With respect to the second question, there's nothing that I've seen specifically around anti-inflammatory elements that necessarily protect. We do know, however, that chronic inflammation is not good, and we see that chronic inflammation exists with a lot of other medical problems. With respect to getting immediate information, we do have helplines available for people. Oftentimes, however, you can imagine there's a lot of people calling in asking those questions, and that's where we find that using the sites that we've recommended in the past are maybe not the quickest, but probably the most convenient way for you to get the information that you're looking for.
Thanks for that answer. Thank you for the question from Gretchen. We've got our next one coming here from Mickey in Green Acres, who's asked me to read it. Question is, what are thoughts surrounding caregivers coming into the home for the elderly and exposure to a vulnerable population? Thank you for the question, Mickey. Who'd like to take that one on?
This is Bob Lutz. Again, I think, as I mentioned earlier, we've been very proactive at reaching out to caregivers, providing guidelines on what they need to be doing, encouraging things like taking temperatures, looking for symptoms, and using all those efforts that we know can protect people from contracting the illness. So again, I think that any caregiver out there is obviously caring for those individuals, and they know and have been provided the guidelines on what they should be doing to protect those individuals they're caring for. Thank you.
Thank you, Doctor. We've got our next one coming from Ted. Hey, Ted, you're up.
Hello,
Thanks for waiting.
Hello, this is Ted from Hilliard. My question was partially answered earlier. My concern is for the construction industry. I have a son that lives in Coeur d'Alene, and they're having a house built, and they're working over there. And it seems like we should be working here. Certainly they could exercise social distancing and still stay part of our economy.
Hi, this is State Senator Andy Billick. Thank you for that question. That is a question and a concern that we've been talking about a lot. You know, there are so many businesses that have contacted my office and the governor and probably every elected official who's here in this room to say, but our business should be an essential business. And individually, they all make a lot of sense. The concern is if you let all of those businesses be essential businesses, then we have the potential to expose more people, which could actually lengthen the health crisis and slow the economic recovery. So it's about getting this balance right. And that's why I think the governor has taken a cautious approach. With that said, I think there is room to loosen up. I think housing is sort of an obvious first step. And as we see the decline in cases, which is hopefully going to hold up and continue over the next period of days and weeks, I think construction should be one of the first industries to come back online. And so I appreciate the question very much, and we'll keep working on it. Thank you.
Thank you again for the answer. We've got our next question coming right away from Denise in Spokane. Hey, thanks for waiting. Denise, you're up.
Okay. Hi there, everyone. I just wanted to say that I do think that there was quite a bit of leadership failure on you guys' part, because we knew that Washington State was ground zero. So we knew that in advance. And here I was, sick, diagnosed with bronchitis. Most likely it was coronavirus, and I could not get tested. I was told I had to wait in my car in 29-degree weather for 2 hours at Chaz before they would see me. There were no tests available. There were no tests available at the at the urgent care. And I feel like it would have been nice if you could have been doing these town halls maybe before. It would have been nice to know how the local leaders felt and that they knew what the issues were. I didn't get that from you guys, which really left me concerned. So there's no telling, I have no idea how many people I probably spread coronavirus to. Back in February, might I add. Anyway, I just want to know, I wanted you to know how I felt. And I really hope that you guys, you talked a lot about all the discussions you had with each other. What you didn't do is you didn't get on TV and let us have discussions with you like we're doing right now, which I think is really beneficial. So I'm just asking, I hope you learned from this, because we knew Washington State was ground zero. The federal government and state government also has accountability, don't get me wrong, but you're our local leaders. We're local, we're family. So I just ask that you please do learn something from this. Thank you very much.
Ma'am, I certainly hear the angst, and I appreciate that. Trust you me that this was a challenge for us in public health and in the healthcare community for quite some time. I think it does unfortunately speak to the limitations that we had in supplies. You've probably heard me saying for quite some time that I really believe that we were having people who were symptomatic, people who had the infection in the community. The rate limiting factor was that we didn't have the means by which we could test people. So yes, we were ground zero. I have no doubt that we had people in our community based upon traveling across the state that were COVID positive. I just couldn't make that diagnosis. So again, I hear where you're coming from. My apologies for the limitations in the system. I do hope that if we're confronted with this again, we can and will do better. Thank you.
Thank you. Thanks for your question, Denise. The next one's coming up from Dale. Dale and Chatteroy, you're up.
Hi, I'm just directing this to whoever would like to answer this question. As our curvature is flattening out in the state, does anyone in our state have a plan on to get us back to work before we implode and civil unrest starts happening in our country?
Thank you, Dale. Who'd like that one from Dale and Chatteroy?
So this is Commissioner Al French. Not aware of any plan at the state. We do know that there are financial resources and other resources that are coming our way. And as we get better clarity about quantity and guidelines around that, we can shape that plan. As I indicated in the opening remarks, we as a community are coming together to create that strategy to be able to come out of this crisis and get our economy standing back up. Our goal is to get the most number of people back to work as possible, and so it's using those resources strategically to energize different sectors of the economy so that we can get everybody back to work as soon as possible. So we're going to create that plan here locally. No one's coming to help us. We got to help ourselves. And your leaders, both in the business community and elected leaders, are coming together to create that strategy.
Thank you. Much appreciate the answer. Thanks for the question, Dale. We'll get our next survey question up, then we've got Lonnie in line after that. So Lonnie, hang tight. We'll get to you in just a second here. First, we've got another survey for our audience. We want to know, in the last 3 weeks, have you experienced any of the following impacts? Press 1 if you've experienced concern about availability of food and or household supplies. Press 2 for loss of employment. Press 3 for stress from disruption to daily routine. Press 4 for anxiety over maintaining connectivity to friends and loved ones. And press 5 if it's a combination of the above. So again, in the last 3 weeks, which of these things have you experienced? Press 1 for concern about availability of food and or household supplies. Press 2 for loss of employment. Press 3 for stress from disruption to daily routine. Press 4 for anxiety over maintaining connectivity to friends and loved ones. And 5 for a combination of the above. Thank you for voting in that poll. We'll have another one in just a minute here. First, let's get our next live question up. We've got Lonnie and Hilliard up. Hey, Lonnie, you're up. Go ahead.
Hi, yes, I'd like to know about the unemployment that they're giving a $600 a week bonus for people that are laid off or not working from the coronavirus. Well, my question is, what are they doing about the people that are still working but are only working half of what they would be working if the coronavirus wasn't here?
Thank you very much.
Lonnie, great question.
Thank you very much for that question, State Senator Andy Billig. And there are benefits available, and it would depend on the specifics of your situation, but being underemployed or losing hours due to the coronavirus or even other factors can qualify you for unemployment benefits. So I encourage you to go to the ESD, that's the Employment Security Department for Washington State website, and it's very easy to navigate. You should be able to get your questions answered. If not, there is a number that you can call, and you very well may be eligible. I'll say generally on unemployment benefits, the Employment Security Department has seen an increase of over 3,000% in claims. And this is unprecedented. So they are doing their best to go through the claims and get people qualified for benefits and get those benefits flowing, and they are doing so. One of the things as a state that we've done is we took away the 7-day waiting period, which used to be if you qualified for unemployment benefits, you had to wait for 7 days after you were qualified for those benefits to flow. That is no longer the case, so the benefits can flow faster, and the federal government has helped us out as well by relaxing some of the requirements and providing some additional resources like the $600 increase in maximum benefit that you mentioned. Thanks.
Thank you, Senator. Thank you for the question, Lonnie. We've got our next one up from Michael right away. Michael in Spokane, thanks. You're up.
Yeah, thank you. Say, first of all of you are trying your best in this difficult situation. My question is, what is being done now to help those in homeless shelters or the poor in this Corona-19 situation?
Spokane Mayor Nadine Woodward, thank you for that question. We get that question a lot. We had the challenge of trying to find overflow capacity for our vulnerable population as we implement social distancing in our shelters. An early assessment indicated that we would lose about half of our beds. And so less than 2 weeks ago, we were able to open up the downtown Spokane Library, which was vacant because of renovation, and we were able to locate 100 of our homeless there. It has worked out quite successfully. We have 40 women from the Hope House, operated by Volunteers of America. We have 60 individuals from our Cannon Street warming shelter. We are also looking for more overflow capacity as we may find more people who need a bed. Going from 6 inches apart, whether it's a bed or a mat, to 6 feet really has been a challenge. And I want to thank the Health District for helping us in our shelters being able to do that. So I think we're doing a really good job. One thing I can say that I'm very happy about is that we have not had a confirmed COVID case in any of our shelters with the individuals or even the staff members. So that is a small success for right now, but I'm very happy about that. I will say we have been able to stand up in isolation in a quarantine facility for our homeless population out at the fairgrounds. That is just about ready to go. So we are working on that, and so far so good. So thanks for the question.
Thanks for the answer, Mayor. We've got our next one coming from Facebook. Looks like a good one for Senator Billig. The question is, how is our food bank supply doing, and how do people get help? Senator Billig, you mind taking that one on from Facebook?
Thank you. I think it's a really important question because food is so basic, and providing that resource is something that our coordinated effort has really been focused on. I know that the food banks are seeing unprecedented demand. At the same time, they're seeing their supply decrease. And so there's emergency funding provided by the state that is going out to the food banks, or to the food banks. There is a coordinated effort to make sure that we not only have the food, but also that we're able to get it out to the people that are homebound. The resources are online, and if you go to the coronavirus local emergency page on the website, there are resources there that will help. And I think that as we go through the next couple weeks, it needs to continue to be the absolute focus to make sure that we've got food on the table for every person. One other thing related to food that I think is really important is the role that the school districts have played. And I have been incredibly impressed with how the school districts have mobilized to continue to provide food for the students and families from their areas and distributing those foods through their schools. And I want to thank them for that effort. Thank you.
Appreciate that answer. Thank you. Thanks for the question from Facebook. We've got our next one coming up from CJ in Fairfield. Hey, CJ, you're up. Go ahead.
How you guys doing tonight? I'm sure you're stressful. First off, I want to say you guys are doing a great job. Second off, being in a small town like us, I think we've got a population right around 600. Are there any way that we can find out, are there cases in our town? That's number one. Number two, sarcastically, I'm saying this, I wish we would have closed the passes when it started, since it started up on the west side.
Yes, ma'am. This is Dr. Bob Lutz. With respect to actually identifying cases in small towns like yours, you can imagine one of the issues that comes up is identifying individuals and then the stigma that is associated. So what we're doing is we are actually mapping where individuals are, but if we have too small a number, we're not actually identifying where those numbers are. And again, that's really for concerns of stigmatization of those individuals who are diagnosed, and also just to, again, protect their privacy. With respect to closing the passes, I think we also have to look at just transportation is universal, and so it's not just people coming from Seattle. It's coming from people all over the world. So people fly in and out of Spokane regularly, and so whereas it's easy to blame Seattle, I think we have to look at just the fact that we are a global community, and Spokane is part of that global community, and we are affected like every other country across this world. Thank you.
Great answer. Thank you. Thank you for the question, CJ. Appreciate you. We're going to get our next one up from Jeff right away. Jeff from West Plains, you're up. Go ahead.
This is for Dr. Lusk. I am curious, is it possible to reuse a face mask by sanitizing it in a microwave? I'm concerned about the supply end of things.
Now, Jeff, thank you for the question. And if it's, for example, the face mask that I'm wearing around my chin, those are probably adequately cleansed by just cleaning them as you would any other clothing, these cloth masks. With respect to actually some of the, what we call PPE, personal protective equipment, that we have really tried to focus on making available for healthcare workers and others on the front line. There are guidelines on how those can be sanitized and reused, and I would just refer you to the CDC site that, again, provides all that information. Thanks for the question.
Thanks again, Doctor. Our next one's coming from Gail in Veradale, but first we're going to run our next survey question for you. We want to know, what is your highest priority in responding to the effects of COVID-19? Press 1 if it's economic recovery and relief. Press 2 if it's providing needed resources and personal protective equipment to healthcare providers. Press 3 if it's continued implementation of social distancing protocols. And press 4 if it's focused on delivery of testing supplies. So again, what is your highest priority in responding to the effects of COVID-19? Press 1 for economic relief and recovery. Press 2 for providing needed resources and personal protective equipment to healthcare providers. Press 3 if it's continued implementation of social distancing protocols. And press 4 for focus on delivery of testing supplies. Go ahead and vote on that one now. We've got our next one here from Gail in Veradale. Hi, Gail. Go ahead.
Hi, this is Gail. I wanted to ask you all, whoever would like to answer this question. My husband and a lot of other people are still working, and he works in retail at Home Depot, and they're not given the option to not work or they will lose their job. And I'm getting very concerned because I'm hearing stories about people all over the country that are in those kinds of positions that are actually dying of the coronavirus. and they are not allowed to wear masks or protective equipment at work. So I wondered if you had any feedback for those kinds of individuals.
Thank you, Gail. Mayor Wick, do you want to take that one on?
You know, I know there's a number of different programs out there for the unemployment. We're trying to encourage our business leaders to be able to help to make sure their employees are safe. And if there are people that go unemployed, there are some security benefits for the unemployment for anybody that's affected by the COVID virus. But again, we're trying to make sure that we're all taking care of each other. I don't know if there's anything else.
This is Dr. Bob Lutz. Again, I think it's a really good point. You know, in public health, we talk about making the healthy choice the easy choice, and that's something that I've really been trying to impart on business leaders. We've been, again, asking an awful lot of people, and that said, we have to do it in a healthy and safe way. And so, you know, it's really comes down to the employer. He or she really needs to provide those healthy options for individuals. I will tell you that we field a number of complaints on a daily basis. And if you find, again, if your husband or anybody else feels like they're being asked to work in an unsafe environment, please reach out, let us know, and we'll look into that. Because again, for me, it's essential that when we're asking so much of everybody, we really need to evenly ask people to provide those resources so that they can stay healthy. Thanks for the question.
Thank you, Mayor Wick, and thank you, Dr. Lutz. Appreciate your question, Gail. Thank you very much.
So this is Commissioner.
Next one up here from Brandon in Spokane Valley. Hey, Brandon, you're up.
Hi. First of all, I just wanted to say I appreciate living in this state, and I appreciate everybody that is doing everything that they can, and I'm just happy to be a part of such a great community. Secondly, I have a family member that is in the medical field who works in a hospital who takes care of COVID patients. And I am increasingly hearing things about not having PAPRs, and obviously we're in uncharted territories, and we're all learning how this thing's going to go. But you know, one day it's N95 is the mask to use, and the next day you have to use a PAPR on the same patient that you just used yesterday. I just would love to see our medical professionals being taken care of in a way that there just is no question about it. Give them the PAPRs, give them all the stuff that they need, and there's just a shortage.
No, again, this is Bob Lutz, Dr. Bob Lutz. I empathize with you. I can't say enough about those first-line healthcare professionals who are out there taking care of individuals. I read about and hear some of the stories from what's happening back in New York. I've talked with colleagues who are taking care of patients, and it's greatly concerning to me, and I think everybody in the healthcare field. I do believe, however, that in conversations that I've had with the Department of Health, they have been out on the market finding necessary, essential personal protective equipment for our healthcare providers, for our first responders. And so although we have been challenged, I am encouraged by the fact that those lines of supply are opening up. And again, but I empathize with you completely. I really want to ensure that my colleagues are safe in taking care of the people that we've taken an oath to take care of. Thanks again for the question and your concern.
Absolutely, great question.
Can I add something to that?
Of course, yeah, go ahead.
So this is State Senator Andy Billig. You know, I appreciate Dr. Lutz's response and completely agree. You know, the other thing that's been really gratifying is to see how, again, how our communities come together. And one of the ways that our communities come together is that businesses have stepped up. And I had a business contact me just a couple of days ago. They're an importer they have connections with factories, and they said, what can we do to help? There are other businesses in our region that are changing their production from whatever they made before to be able to make PPE and other needed supplies. And I just really appreciate their efforts. I certainly appreciate the efforts of our public health workers, our the frontline workers in the hospitals, people that are working in retail, like we heard on an earlier question, and everybody that's out there in harm's way to help our community move forward. Thanks.
Thank you, Senator. Let's get our next one up. We've got Cliff in line next. Hey there, Cliff.
Yeah. My term is rent control, and the time has come. We need to establish rent control in the city of Spokane to deal with these greedy landlords that have dealt blows to a person like this fellow that came on the air and said his rent just increased. They are taking advantage of an influx of people coming from other places, the Puget Sound mainly, where they've been driven out of their house because they can't afford to live there.
Thank you so much, Cliff. Mayor Woodward, can you take that one for Cliff?
Thank you for that question, and we have received questions like that in the past. I know Council President Breann Beggs is here, and that's something the council has had discussions about is rent control, and we will continue to have discussions. We understand that this is a tough issue, because we want to listen to our renters, our tenants, and we want to listen to our property owners. And there has to be a balance there. We can also acknowledge that we have some property owners in the city of Spokane, a very small percentage that are problem landlords. And we need to deal with those landlords, I believe, on an individual basis. But again, we need to balance the rights of the landlords and the property owners along with the tenants and have a fair and balanced playing field. So your concern is, we hear it, and we are working on some solutions to that. I look forward to working with the City Council on that very subject. Thank you.
Thank you, Mayor. Very much appreciate that answer, and thank you for the question again. Our next one is from Facebook, and the question is, when are we expected to see the new testing for everyone that may not have symptoms or have had very mild symptoms and may not have known they're positive for COVID-19? Let's see. Thanks for that question. Who'd like to take it on?
I think that question is probably directed towards me. This is Dr. Bob Lutz, and I think there are a number of testing strategies that are on the horizon. Right now, our focus has really been diagnosing those individuals who have the infection. We obviously, especially as we want to move forward with the recovery, we want to be able to identify those individuals who represent ones who may have been asymptomatic, meaning without symptoms, or again, can get back into the workforce. And so those tests are out there. They are not here currently, but again, I am encouraged by what I'm reading in the literature, that I believe that within the next couple of weeks, next couple of months, we'll see those. But again, acknowledge that it is the next step. It's not for right now. Rather, it's for when we start to open up, and then when I can really understand the whole way that I can get people back into the workforce. Thanks again for the question.
And thank you again, Dr. Lutz. We've got our next one coming up from Paul in Otis Orchards. Hey, Paul, you're up. Go ahead. Thanks for waiting.
Okay, thank you. I have kind of a two-part question. How likely is it that the stay-at-home orders will be extended past May 4th? And when the orders are lifted, will they be lifted all at once, or will the restrictions be lifted gradually?
This is Bob Lutz, and it's kind of fun being up here because everybody looks at me to answer these types of questions. So I would, with respect to the Stay Healthy, Stay Home order, my expectation is that it will not be lifted very suddenly. I think, as one of my mentors, Dr. Anthony Fauci, has said, I think we need to keep our foot on the gas because what we don't want to have happen is a resurgence of this and finding ourselves back to where we started. So I believe that the prudent course is a gradual lessening of those restrictions. And so again, I do not know necessarily that they're going to be extended, but if they do get extended, it's going to be, again, to gradually lighten as we see the number of cases decrease and we truly believe that we have flattened the curve and that the disease is in control. I think it also speaks to the fact that as I know more about the disease, I'll be better able to understand how to move forward. Thanks again for that question.
Thanks so much, Paul. Appreciate you again, Dr. Lutz. And we've just come to the end of our hour, so I'll ask each of our speakers that we have on our panel for our forum tonight to each come up and the microphone in turn and go ahead and give any closing thoughts you have before we wrap up. Who'd like to start?
Well, this is Bob Lutz. Again, I think I would just like to echo what I just said. I think that this has been a challenging time for all of us. I think Governor Inslee was very insightful at his stay healthy, stay home order. I think that it is one that we need to take to heart. And as we start to see the light at the end of the proverbial tunnel, we need to acknowledge that it's down the road and we need to cautiously return to life as normal. But again, I do not want to be here again. And so I think we need to be really cautious and prudent as we move forward. Thanks again for listening this evening.
Spokane Mayor Nadine Woodward, I would just say that I couldn't be more proud of our region and the way that we have handled our COVID response. And to work with the Valley, with all the cities in the county, with our state lawmakers, and doing everything we can to protect our communities. We are, each one of us, soldiers in this battle. What we can do, the easiest thing, the social distancing, the staying at home when you're not feeling well, just the staying home, period, and proper hygiene, and washing your hands. It sounds so simple. That's what it takes for all of us to make a difference in this fight against COVID. And I just want to say, I think it's the unknown that instills fear in people, not knowing when the stay order will be lifted, when our businesses and our downtown areas will open up again. But just know that in tragic times, it brings out the best in all of us. And we are resilient, we are inland strong, we are working together, we will get through this, and we will all be better when we get on the other side. So thank you.
And this is Mayor Wick from the City of Spokane Valley, and similar to what Mayor Woodward was saying, there's more than just those of us that sat up here tonight that you got to see. It's all the small towns in the county as well, the Millwoods, the Liberty Lakes, the Airway Heights. We've all been working together to this to kind of come up with a regional approach and plan as we go through this. So there are many more faces that are not on the camera today that are also behind this, and we can all come together to move our community forward. And I know it's scary also as you go to the grocery stores and take the risk to get your essential supplies where there's not as many supplies on the shelves. Rest assured that as part of our plans, we are working on the supply chains to make sure that those supplies are continuing to come into our community and continue to ask you to buy what you need, but please don't hoard, so that way the supplies are there for everybody as we get through this together. So, thank you.
Al French, County Commissioner. This community has a legacy, a history of taking on challenges and coming up with creative new solutions. We've done things that other communities in the world have never done, and we will continue to do that by pulling together, working together, and we'll come out on the bright side of this together. So you have some incredible leadership, both elected, community, the health district, the medical community, your first line responders, the business community. We are all mobilizing to be able to make sure that we come through this strong, united, and moving forward together. So look forward to being on the other side of this with all of you.
Thank you to everybody that participated in this call, who listened, who asked questions. Thank you to my fellow participants in the call up here on the dais. Look, we still have some tough days ahead of us before this health crisis ends and we get the economy back on track. But I am optimistic. We have a resilient state, resilient people in Washington, and particularly in Spokane. And we're innovative, and we're working together as a community. What we're doing right now is working. And we just keep at it, and we've got the momentum on our side to not just make ourselves safe and healthy, but also to have a robust economic recovery. I thank all of you for participating in your community, for helping to keep yourself and your neighbors and your friends and your family safe. Please keep it up and keep in touch. Thank you.
Thank you again, everybody who's joined our live teletown hall tonight. We really appreciate you. Thank you again for joining us. If you didn't get a chance to give us your email address, you can stay on the line as we wrap up here. Leave it in a voicemail message. Make sure you spell anything very clearly. If it's a complicated email address, you can stay on the line, leave those as we close out the call here just by staying on the line to leave those voicemail messages. Really appreciate your time tonight, everybody around Spokane County. Of course, thanks to all of our featured speakers on our panel for joining us and answering your questions. Everybody stay safe out there and have a good rest of your night.